Welcome to Medical Monday. I'm Lisa Carberg, medical reporter here at WTNH News 8. Today, we have another great segment of great informative information. Dr. Ken Donovan is joining us. He is a physician in Essex with something called Signature Care. Doctor, welcome.
Hi, Lisa. Thanks for having me.
Great to have you. So let's start out. Let's take a look at the report. I came out to your office, and this is my report on your care.
We found that it really wasn't working for us.
Laura Lee Miller of Lyme talking about her previous doctor's practice. She leads an active life, staying healthy, and was not happy with the level of care her family was getting.
Everything just became more complicated as you needed more referrals and you needed more time with the doctors, etc. Since we last spoke, I have been very focused on my exercise.
Excellent.
She found Dr. Ken Donovan of Signature Care in Essex. The practice is a concierge, membership-based medical practice. Dr. Donovan left a busy hospital job to provide on-call, one-on-one quality care.
It allows me to have longer visits with patients, same-day access, and all of the patients have my cell phone number and my personal email.
Signature Care is $2,500 a year, not covered by insurance. Dr. Donovan has 200 patients. A typical practice has over 1,000. This waiting room is usually empty because he takes one patient at a time. Laura Lee is pleased.
You have enough time to talk about your problem, to talk about solutions, and to ultimately come up with a plan.
They're often surprised when I call them out of the blue to review their labs and things like that, even when they're normal.
So, Dr. Donovan, Signature Care, tell us what you're all about.
Sure, Lisa. So this is what's known as a concierge medical practice, which really is just a term that's come into vogue here to describe practices that are charging a membership fee to allow a very small patient panel. That allows the patients to have longer visits, typically an hour long, same day access, immediate responses from their physicians. They have my cell phone number, my email, etc. And so it just really allows patients to have more access. And so that's really what we're about at Signature Care, is just a practice that allows patients to have greater access to the physician and to help with their healthcare needs.
It's something maybe not everybody can afford, but it's something I'm just watching as medicine changes over the years. It's kind of a different avenue, whereas COVID kind of introduced us to telemedicine, and that has evolved into an entire new field for people to get care from anywhere. So this is just kind of a different avenue of that. How many patients do you have at this point?
Currently, we have about 250 patients. And interestingly, when I took over the practice several months ago, it had been grown by a previous physician to about 150 patients. But we've added 100 additional patients in the first 6 months, which was a little bit surprising to me. There is a tremendous amount of demand for this. As you pointed out, things have changed quite a bit in primary care. It's become really difficult for the docs out there practicing in the traditional model. Typically, they're seeing patients every 15 to 20 minutes and seeing 20 or more patients a day. And really having challenges because of all the documentation that's required and all of the insurance pre-authorizations and prescription refills and all of the, things that come along with being a primary care provider. And so I think you might see more physicians like myself transitioning into this model of care.
Sometimes you hear the doctor take your folder off the door when you're in the waiting room and they glance at it and you wonder if is that all they know about me sometimes when you go in, or if it's a walk-in clinic or someone different in your practice. How much more time do you devote to your clients?
Yeah, so I think that's one of the things that attracted me to this was I really do like to get to know patients, like to really understand their background, their wishes, what's important for them in their healthcare. And so, typically we do hour-long visits for our patients, and I have some gaps in the day as well that we leave open for any sick visits that patients have. And then I have another window of time where I'm able to sit down and kind of review all of the records for the day and kind of refresh my memory and, think about what we talked about last time and what we need to follow up on this time. So It's really, it's the kind of medicine that I think most physicians imagine when they go to medical school and come out and want to practice, but the finances of traditional primary care just don't allow that. And so, this model, because of the membership fee, allows the physician to do this. And I think you'll start seeing more and more of these practices evolve, as we continue to have a shortage of primary care physicians.
And I was just going to ask you about is there still a shortage of primary care physicians? People just don't
Yeah.
find it lucrative after so many years of medical school?
Yeah, it's a combination of the finances. Medicare has decreased reimbursement, traditionally over the years and made it a little bit more difficult to actually make a living as a primary care physician. So that's forced most primary care physicians to join healthcare systems, and there's very few sort of independent practices anymore. And so in the models with the healthcare systems, obviously, there needs to be, some eye towards productivity and profitability, and so it becomes very tough. So these jobs have a tremendous amount of burnout, and so they're not very attractive jobs necessarily to folks who want to go into primary care. And so it's been more and more difficult to find new docs to fill in. A lot of the care is being delivered by APRNs, who are excellent. I've worked with many over the years and helped train them, but it's challenging for them as well because the time demands on the APRNs are just as significant as on the physicians. And so you see a lot of turnover in practices nowadays. And I think patients are feeling that. That's been a common refrain that I've heard is, people have seen multiple practitioners over the past 3 to 4 years, and so they're looking for some consistency.
We're back with Dr. Ken Donovan of Signature Care in Essex. Dr. Donovan, tell us a little bit about your background. I mean, you've seen it all. I'm sure you've seen burnout. You've worked in a hospital setting. Tell us a little bit about yourself, your past, and how you came to this.
Sure. So I've been in practice for 25 years now. I'm an internal medicine physician, originally from southeastern Connecticut, and sort of moved back here after my training and to practice in the area. And at that time, a new specialty was really taking off called hospitalists. And so I spent a great deal of my career in the hospital working as a hospitalist or a hospital doctor. And then that role evolved into several administrative roles. I was the chairman of medicine down at Lawrence and Memorial Hospital in New London, and then at Westerly Hospital in Rhode Island as well. And so I've done, the clinical bedside care and the administrative care. But I always knew that I wanted to do primary care. That's what I went into medicine to do. But I just couldn't find the right job or the right sort of setting for myself over the past 20 years that didn't involve this model of really short visits and really large patient panels. And so it just never felt right to me in primary care. And so, as this concierge model developed over the last few years, I've been sort of keeping my eye on things and thinking about when I was going to make my exit from the hospital and into this realm. And over the past year, this opportunity in Essex presented itself, and it's been really a great fit.
How are you liking it? Do you get more of a sense of fulfillment as a doctor?
Yeah, I do. I mean, I enjoyed working in the hospital because obviously in the hospital stakes are pretty high. People are very sick, and it can be very rewarding when you help them. But we had the same demands that really started over the past several years, which was we had to see more and more patients in, the same period of time. And so the patients in the hospital started having the same kind of issues that people are having with primary care physicians, where I had to be in and out of the room in 5 to 10 minutes because there was so much to handle in terms of documentation and things with the pharmacy and things with billing and things with talking to specialists and such. So that job, has a high degree of burnout. And so when I came into this role, I wanted to make sure that I wasn't in that same situation. And so having all of that time to sit with patients, to call them on the phone, to talk to them, to answer the questions of their family, to really spend the time that they deserve it's very rewarding. And I've already had some really intense situations with new patients where we've done some really good work together in a short period of time, and it again it makes me feel like I'm doing what I'm supposed to do and what I went to medical school for.
People say, well, doctors make so much money, but they can't make money until they see so many patients. So it's a very demanding job on so many levels, as you think about it. So tell me about your patients. You had told me that a lot of them are older, they over 70. They need more medical care, right?
Yeah, yeah. I think most of the patients that seek this model, typically need a little bit more care. And so I would say the majority of my patients, fall into that over 70 category. Some have lots of medical problems, some have none, surprisingly, but they really just want the access and, in case things take a turn for the worse. But what's been interesting over the first 6 months of growth is that we've also been getting calls now from 40-year-olds and 50-year-olds, again, who have just become a little bit, I would say maybe frustrated with the inability to get in to be seen quickly by their providers, or not getting calls back in a prompt, amount of time, just because of the demands on the provider's time. And so we're starting to see that age range come down a bit. But clearly the bulk of the patients are always going to be in that geriatric category, or over 70 years old.
And tell me, we are going to talk with David Gladstone, who is the president of the Middlesex Medical Group, in the next segment to talk about the demand. Have you peaked out at your number of patients?
Not quite. I think, we'll still be taking patients, probably for another 2 or 3 months, but I think by the spring I may be capped out, which I didn't really expect. I thought it might take, anywhere from 1 to 2 years to really build a concierge practice, because, as you said, there's a financial component to it, and I wasn't sure that, people would really be willing to switch to a model where they have to pay a membership fee, where now they don't have to for the other practices. But um, every day the phone is ringing, and we're adding 2 or 3 new visits a day. And so, as I said, we've added 100 patients since August. I'd like to probably add another 50 patients and then kind of reassess. Nationally, what we've learned from talking to other concierge practices is they range anywhere from 300 to 500, kind of depends on the demographics. But I think because our practice is very heavily weighted towards older patients, I'd like to be on the lower number of that scale so that I have the time to devote to them and their families.
Yeah, and I should say this is a healthcare model that isn't brand new. It's been around for years, and we've been hearing about it, different names, different brands, different businesses. But you're here on the shoreline in Essex, and we'll talk about some talk for expansion as well and the care. All right, practical question. You see a lot of older patients. Tell us the most common health issues that we would want to avoid.
Hmm, that's a great question. I think there's several that kind of fit that bill, as we age, that if we don't take care of ourselves in terms of our weight and our cardiac health, those things can spiral into problems. So, managing high blood pressure, managing weight, managing blood sugars, managing cholesterol, all of the kind of basic things that your doc starts talking to you about in your 30s and 40s, that some of us kind of turn a blind eye to because they're kind of silent and you don't feel them. Those do come back to haunt you in your 60s, 70s, and 80s if those things haven't been controlled. Also, really important to stay active. Muscle mass declines pretty rapidly as we age, and it's hard to get that back. And so the falls begin, and people start getting into trouble with falls if they haven't kept up their physical health and their strength levels, in their 40s, 50s, and 60s.
All right. Dr. Ken Donovan of Signature Care, thank you so much for joining us and telling us all about your practice. It's very interesting. We look forward to seeing how this goes in the future. As I said, there are many types of practices like this out there, but you're new to it and you're building it quickly. And you say it's fulfilling, and we wish you all the best. Thank you so much, Dr. Donovan.
Thank you, Lisa. Have a great night.
You too. We are back with David Gladstone. He is the president of the Middlesex Medical Group. Thank you for being with us, Dave. This is very interesting about Signature Care. And we're also going to talk about Middlesex primary care. And we were talking beforehand how you mentioned you can get excellent care. There are many avenues of getting care through Middlesex Health. Do you mind if I ask you first how Signature Care came about?
Sure. So we had an opportunity, a pre-existing relationship with Dr. Peter Dixon. Peter had been, his background is he was a hematologist oncologist who migrated from hematology oncology to open what became a concierge practice. And I think Peter was prior to his was before his time, and he started a concierge practice before the term concierge practice existed. And that was the way he could see the patients and give the patients the time that he wanted to give them, was by collecting a fee up front. Peter was looking to retire, and he wanted his patients taken care of. Peter had a relationship with Middlesex, and he offered us the opportunity to purchase his practice if we could find the right doctor. So Peter and myself set about trying to start the practice and to regenerate the practice under a different name, Signature Care. And we acquired the practice as of August 1st. We hired Dr. Donovan as of August 1st. And that's the genesis of Signature Care.
That's very interesting. All right. Now, also, you have a lot of primary care physicians in your group. Tell us
Correct.
about that and how they still get very good care.
Okay. So we operate Middlesex Health Primary Care. Middlesex Health Primary Care operates in 11 different offices, mostly in Middlesex County. Some of them are just outside of Middlesex County. We're in Madison. And we have an office in most towns. Middlesex Primary Care has about 65 providers, about 45 physicians, about 20 advanced practice providers, either APRNs or PAs, and we offer excellent care at these offices. We're very much a community-based organization. The physicians and APPs within Middlesex Primary Care each carry a larger patient panel than you would in a concierge medicine practice. So we've been in that business for 20 to 30 years, and we decided strategically that we had to have an offering in the concierge medicine space for the patients that needed that. Because what we've identified is there are patients that fit the concierge model, and there are patients that don't require the concierge model. And we are here to care for both patient populations.
And we should say, with the primary care, you're still going in, you're seeing a familiar face, you're in a familiar office, whether
Yes.
it's a doctor, an APRN, there's some familiarity with you and with the practice. Tell us about that.
Sure. So I see Middlesex Primary Care in Durham. I have a primary care physician that I selected, or that is assigned to me, however you want to put it. So our model is we try to get everybody in to see their primary care provider. If I have an acute need come up, let's say next week, and she is not available, then our model is we look to her partners in that office. And again, I'm in the Durham office. So we look to her partners in Durham to see, can they see me as her partners to cover for her? If that is not available, then we have both an acute care provider in what we call the North County area that covers Durham. We try to see if she's available, or we look to surrounding offices. So we try to keep people as close to their primary care physician if they can't get in to see their primary care physician. And that's the way our model works. And you can communicate with your primary care physician through our portal, and that's the approach that we take.
Tell me about your Westbrook location that we see off of I-95. I know it's a real emergency room. What else do you have there?
Okay, so let me describe the building, the way the building is laid out. So we have an emergency room, a full service emergency room that has the same basic facilities except for inpatients that the hospital has, but full emergency care takes in ambulances, traffic as well. In addition, on the first floor, we have imaging, full service imaging, MRI, CT scan, fluoroscopy, etc., full service imaging. We have a full service lab, and we have a full service cancer center in that building. We also have a small infusion center. That's all on the first floor of that building. On the second floor of the building, the Connecticut Oncology Group has their practice upstairs, and that's where they do chemotherapy on the second floor. And then we in the medical group have a large space for primary care on one side of the space, and it's connected to specialty care. So for most of our patients, we try to rotate almost all of our specialties through that building. So you can see urology 5 days a week. You can see OBGYN at least 3 days a week. You can see a general surgeon a day or two a week. And each of our specialties rotate through that facility. So it's a full service medical facility to service the shoreline in Westbrook, right
All
off the
right.
highway.
We're down to about 2 minutes. Tell me quickly
Okay,
about the new Cromwell building. You can tell which highways I drive in
sure.
Connecticut. Tell me about that one.
So we had a Cromwell practice that kept on growing, and that was in the building next to our building. So we were in 80 Shunpike Road. We had outgrown our space. The third floor was full, and we needed more space. We decided to work with the owner of 80 Shunpike. We developed 70 Shunpike as a new building, and we built out and we have a 22,000 square foot medical office building there. Services offered there are primary care, physical medicine, physical rehabilitation, and we have laboratory services in that building. We've got some capacity to grow, but it expanded our capacity by about 30 to 40% given the growth what we've seen in Cromwell, and that's what the brand new building is about.
All right. And as we wrap up, back to signature care. You have plans to expand that as well?
Yeah, where the plans are soft right now as we look at it, we've seen the market demand grow for signature care. But when Dr. Donovan and I started signature care, we had a plan in mind of how we could grow it and what the mechanics would be for doing that. It is critical for a signature care practice that you have the right physician, the person with the right temperament, the right demeanor, and quite frankly, the right medical experience. Because typically, the patients that go to a concierge practice have greater demands than those that would go to a standard primary care practice. The people that go to a concierge practice want to get almost all of their care through the concierge practice. So we'd have to find the right physician and, quite frankly, the right office staff as well. There's an expectation of a service level that people have when you go to a concierge medicine practice. So we would like to open another practice of the same vein. We just have to find the right talent to be able to do that. And then lastly, the right space to be able to do it, because it would not be in the same space as a primary care practice.
All right. David Gladstone, president of the Middlesex Medical Group. Thank you for all this great information. Thank you for your time.
Thank you. Have a nice evening.